So good afternoon, colleagues, and welcome to the last session of our lovely day. For those of you who haven't met me yet, I'm Amanda Howe. I'm past president of the college, handed on to Claire in late November. And before we have our afternoon plenary, I'm going to just announce the outcomes of the poster session. I hope lots of you saw our posters. We had 4, but beautifully formed, and I'd like to thank, and in fact we will ask all those who are still in the room who put posters to stand up and be clapped. Margaret Ikpo, who you met in the morning plenary, and I were the judges, and we award a winner and the category of highly commended. And so the results are, for the winning poster, we would like to congratulate Eleanor Swanton and Shivani Patel. So Eleanor, please, are you collecting on your behalf? So this poster was the one about barriers to registration, showing in Leeds how many practices didn't actually understand the rules and how that can, it's an ongoing discourse with which I am familiar, but you know, it was very good to see evidence of the mismatch between what practices were doing and the actual guidelines. And of course, the problems that that presents for people who anyway are often in marginalised and difficult and transient situations. So very well done to you both, Eleanor. And here's your prize. Bravo. Well done. And for the highly commended, Margaret and I felt that the other 3 were all to be highly commended because they were all good pieces of work, very different, you know, but clearly one of them, I hope you saw them, but one of them was about helping to encourage public understanding of the bowel screening test and public uptake and how, you know, students could perhaps help with that. And another was about the impacts of case-based learning in the curriculum. And the third one was about, you know, a discourse around the impact of restricted space and health in overcrowded housing and some experiences of that, but raising the bigger question about what that tells us about physical space and well-being, both outdoors but also indoors. So well done to all of them. And I would like to invite the authors here to stand up and get a clap. So your one was the space and COVID, wasn't it? Well done, and well done to the others. And the highly recommended group will get their certificate and voucher after the conference. So well done, everybody, and thank you very much for organising that to my team. And over to you, colleagues.
Thank you very much, Amanda, and hello again, everybody. We're here at the final session of today, which is Generations of General Practice, Reflections on the Past and Visions for the Future. This is going to be a kind of culmination of the themes of today around transitions and the bringing together of different generations of GPs for a really interesting conversation. As always, we're going to be coming to the floor with our roving mics for questions throughout, and also for everybody who's joining us online, please do submit your questions in the Q&A on the Zoom. I'll be keeping an eye on it and asking questions to the panel. So we're going to do a quick round of introductions. So I'm Anthony James. I'm a First 5 locum GP, Chief Operating Officer of Pink News, and many of you have heard me say that at least 15 times today, I think, already. So we're going to hand over to the rest of our panel. We'll go down the line, so we'll kick off with John.
Afternoon, colleagues. My name is John Spicer. I am still just a GP in Croydon in South London and doing various other things for the college and in teaching.
Hello everyone, I'm Pam Martin. I was a GP for 30 years in South London in the inner city, caring passionately still about getting the job better for everyone, still acting in the role of a mentor to some younger colleagues, and I continued on the BMA GPC negotiating committee until 2020, and still part of a local community group trying to address health inequalities through harnessing the experiences of local community activists.
Hi, I am Chee Yeen Fung. I am a first vice GP as well. So I qualified last year. I'm a salaried doctor in Camden, up the road. And I have a number of different roles, but at the moment I'm still working at Imperial, the Medical Schools Council, and I do a bit of the GMC as well. I'm also the founder of the Dr Me project, which is a volunteering program where I train up medical students and GP trainees to go out in the community and teach primary school kids about self-care, which has both a health education impact as well as a widening participation impact as well. So that's me.
Fantastic. Thanks, everybody. So we've got some questions that we've pre-prepared just to get things warmed up, but we'll be coming to the audience regularly for questions. And as I say, everyone online who's watching, do submit them in the Q&A. I've got them here on the laptop. Our first question is, going back to the kind of genesis of this session was, I think, a previous session that was run, which was reflecting on things I know at 50 or 60, which I wish I'd known at 30. So to our panelists, the first question is about, what is there something, whether it relates to training or your career, that you wish you had known earlier? And maybe if we start with Chee, first of all.
Oh, so things I wish I'd known. I think the main thing that I've really appreciated throughout GP training is that the opportunities are genuinely endless. You can literally do whatever you want with it. And I think the way GP training is structured really allows you to make the most of it. Everyone gets self-directed learning, which you can really use to develop yourself professionally and, you know, look into different interests that you want to sort of pursue. And I think I think the same for you as well, Anthony. We took some years out, so we were able to take out of program opportunities as well. I did 2 fellowships in my 3-year training program, but it meant that I was really able to tailor my career to what I wanted it to be and make it, you know, so be able to build my career from day one of GP training, which I think is so unique to general practice, and make that something, you know, it's not just about your career and your job, but actually it's a sort of way of living that allows you to sort of do the things you enjoy alongside, you know, the life that you want to build for yourself. So I think that's a really beautiful thing about general practice.
Definitely. I think the idea of making the most of your training is a really important one, and what that looks like is really different for different people as well. So when we were doing the speed mentoring earlier, I think like it was me, Chee, Rob had all done or were in the process of doing like the same fellowship scheme, which was an incredible opportunity, but equally what was right for us might be very different to what's right for another trainee as well. And there are a huge number of opportunities, but equally just making the most out of your training can look like really diving into consultation skills, the relationships that you have with your patients, and making sure that when you finish training, you leave feeling well equipped and skilled to take on the challenging role of what being a GP is as well. So I think, yeah, there are huge numbers of opportunities, but I also feel really lucky that I got to get that kind of concrete foundations in the consultation skills, which make up such an important part of the job as well. I don't know if we come to Pam. What's something that you wish you had known earlier on in your career?
More than one, a lot, of course. But I think one big thing is the extent to which actually there are choices there for us all as doctors. And one key choice, I think, is about how much of one's life one wants the being a doctor part of it to be, or in later career, using the skills we used to use clinically. Certainly what's true is that being a doctor doesn't have to be a treadmill, though I really wish I'd been able to make use of a coach or a mentor more than I did earlier to look at the choices available. And another thing I think is the slow realization that actually I'm only a small bit of what goes on for people as an influence on their health. And I think although the job was very all-consuming for me, it took me a while to realize that I wasn't the be-all and end-all for patients, and if I'd known that earlier, it would have limited my sense of responsibility and to some extent then my own stress. And that takes me on to stress management. If you're too stressed to be kind, something's going wrong. Like also if your team is too stressed to talk to each other and develop ideas. That's another thing. And another is the importance of self-care and not just giving lip service to it. And I realise also as I sort of go on through life that the ageing brain and body actually takes different care, needs different care from a younger one. There's something for every stage of life.
Thanks, Pam. And John, what's one thing that you wish you'd known?
Well, in a sense, Pam has taken the words out of my mouth already, because I would have said pretty much all of that. The thing that occurs to me now at 60-something rather than at 30-something, as you prefaced your question with, is about being a generalist. And the word has been used a little bit today, because that's clearly what GPs are. We are generalists. We do all sorts of things. And by inference, we are flexible. We like to take advantage of opportunities that might be educational or experiential or whatever. And I think I've done that in the sense of being the lead GP for a number of things over the years, child health surveillance. At one point I was the chief coil fitter, you may be astonished to hear. Now somebody else has taken that over. But one can move through different stages in your professional development over those years, and that's a fabulous thing, which I think is actually much easier working in primary care than in the four walls of a hospital. But as well as the points that Pam's made, I think I probably would have let my academic gene express itself rather earlier than I did. And I was 40-something when I did a master's, and that led into quite a profound career change as a teacher. And I think despite the pressures of having a young family and a new job and all the rest of it when I was 30-something, I probably should have taken that academic turn about 15 years earlier than I did, because it's actually quite easy to do if you're interested in doing it.
Mm-hmm. Yeah, I think those are all really fantastic reflections. And I think going back, I think something for me, going back to, I think something that Claire said this morning in our first session about the need for unity amongst the kind of GP workforce. Actually, the thing that I guess I don't know if I wish I'd known earlier, because I feel like I found it out quite early on, is actually the diversity that everybody brings of opinion, of passions, of desires to general practice actually does make it, to me, one of the most kind of energizing places. Today is an example. Having a forum like this for the sharing of knowledge at all stages is really, really fantastic. If I think about some of my favourite memories of my relatively short GP career so far, but those come back to things like annual conference and opportunities for lots of people to get together to talk about important work things, but also to feel part of something bigger than a whole and bigger than an individual practice. And I really feel that general practice does offer the opportunity for that. So while there may be kind of friction and kind of lack of unity in some areas at the minute because of the sheer pressure that everybody's under, I think underlying that is a professional body that offers so much to one another and is so willing with their time and generosity to help one another develop. I think is something really special, and something that for everybody in the audience who's thinking about a career in general practice is a really important thing that I think is lacking in many other jobs and many other industries as well. So our next question is about transitions, the theme of today, and being able to navigate those successfully, and some of maybe the tips that you have for how to navigate transitions. We've obviously got, again, people from prospective GPs, medical students, as well as those later on in their career and retired members. All of us have to face different transitions, and those types of transitions have changed, particularly over the last couple of years, as we were hearing earlier during our reflections on COVID in the session after lunch. But what are some tips that you might have picked up along the way for how to manage some of those transitions effectively and the challenges that can come with those? Maybe this time if we start with Pam.
Right, well, I think the most important thing that's sort of a theme of the day as well is learning and sharing with contemporaries and listening to others. My young practitioners group is still meeting after 35 years, and we've navigated, there's 6 of us out of the original 9, and we've navigated everything from the clinical uncertainties of early practice to bereavement and moving on to life beyond clinical practice. I think another thing is trying to get the being a doctor part of life as enjoyable as well as, giving as much job satisfaction as possible. And then in later career moving on, one can reflect back and actually say, as I think Claire said today, the amount of change management you've done in consultations, to actually recognise, been there, and I have helped with those achievements. And I can't resist one anecdote of when I retired, this was something that helped me with the transition, that actually quite a lot of people did bother to come and say thank you. And these were often people who really surprised me. One of them was an ex-drug addict who'd seen me regularly over 18 months and ended up drug-free. And he came back to say goodbye a few years later and said, you know, when I was thinking of using it, really helped to think how much I'd hate looking at your sad, disappointed face. And so getting job satisfaction certainly helped me with my transition away from clinical practice, and I'd been there and done that. And listening to others, if you have a formal mentor, all well and good, but anybody can tip you if you listen. And I did a master's in my 40s because somebody had said to me, gosh, you sound like you're getting burnt out, don't you need intellectual refreshment? So somehow keeping fresh, keeping alert, and listening to others, it helps.
Thanks, Pam. Chee?
Yeah, I think for me, so I had a really interesting transition recently in that I actually was on a fellowship year as I finished GP training and missed the pandemic. So I finished GP training, face-to-face, training, and then sort of came out as a GP on the other side, missed a year, and then was like, oh, okay, we're in a pandemic now, go be a GP. And what it made me realize was how important my training was and how good the quality of my training was. And I look back and gosh, it was very, very scary in the first few moments, but actually, when I look back, I remember thinking I know we've talked a lot about, all the opportunities that come with training, making the most of those times that, professional development time, but actually, I remember sitting down with my trainer in my SD3 year and said, look, I'm paring back, I'm gonna calm down some of the other activities, and I'm gonna focus on really learning to be a good GP. Because actually, if you can't be a good GP first and foremost, and you don't engage with your actual training there, the rest of it's kind of irrelevant if you can't do the core of what you're sort of, made to do and called to do. And it really showed in that moment when I sort of came through and was like, okay, I'm a GP now, middle of a pandemic, and pulling out those bits of knowledge and bits of training that, that I'd learned whilst the trainee, and being able to apply that to the situation. Actually, I managed those telephone consultations because I had practiced that in the out of hours setting. I'd learned how to do it. It wasn't what I thought I'd be doing, but actually the training was there. And shout out to Dr. Branker if you're listening, my trainer in Lewisham, was the amount of care and attention you get whilst a trainee and the investment that's put into you, none of it's wasted, and just being really mindful that actually everything you learn, there is a reason for it. I know sometimes it seems a bit tick box and it's oh, what am I doing? And there's so many other fun things going on, but actually that's the core of what we're here to do, and really focusing on that, don't take your training for granted, but actually, that's what you're being trained for. So yeah, really investing in that whilst you're there.
Definitely. I mean, I think from someone who's been through a transition to doing something alongside being a GP, which is 100% non-clinical, actually the core skills that you learn throughout general practice, managing people's expectations, addressing people's ideas, concerns and expectations, dealing with difficult patients, dealing with politics in the workplace, everything there and the fact you get so much investment into you as a trainee, you have that one-to-one relationship with your trainer, and you really do get to develop these world-class consultation and interpersonal skills. That sets you up for doing a whole myriad of other things. So whether that's in a kind of more medically orientated way or doing something completely separate like me, I really feel like I've been able to build an amazing skill set which is applicable in so many different arenas, even in my personal life. My husband's actually joined us this afternoon, he's in the audience. He might say my interpersonal skills are less than ideal sometimes. But in general, I do feel I just feel very privileged to have been through the training program as it is at the minute. Yes, things can always be improved and bettered upon, but I think, yeah, we've been set up pretty well for future career. And that fact that can take you can have so many different types of career in a single career and have so many transitions, I think is something really special as well. John, what do you think?
Yeah, I'd like to pick up that point you've just made about transferable skills, because the skills one learns in GP training and in the professional development that follows it are applicable to so many things. I thoroughly agree with that. Most obviously in the educational world, which a lot of us do as teachers and trainers, etc., but also more generally. To go back to your question about transitions, for me, there are two sides to this. One is the thinking that happens before you transition, which sounds a bit abrupt in a way in those terms, because often we think about the new roles or the new functions or the new whatever we want to do before we actually fill in an application form or do some other way of preparing for it. And I think the most important part of that is to bounce it off somebody else. So that could be formally as a coach or a mentor. It could be informally over a cup of tea or a beer with a friend. It could be all or some of those things. And in thinking about what you want to do, how to make that career happen in all its different facets is incredibly important. The actual transition itself, if we are going to kind of think of it in that abrupt way, the way not to do it is what happened to me and probably a lot of other people in your first house job, or what's now an F1. For me, it was 1977 in Leicester General Hospital, and it was the worst possible transition you could imagine. Starting on a ward full of sick people, being on call, no induction, etc., etc. One hopes that sort of transition is ancient history, although maybe it's more common than it should be.
Mm-hmm.
But I think that one needs to actually develop organisations which know how to bring on new people and welcome new people. And I'd include practices in that. And sometimes it's done very well, and I hear from some people that sometimes it isn't. But I think it really is a duty of all practices, all hospitals, all healthcare organisations to actually welcome and induct, I'm not sure what the right word is, new entrants, whether they're teachers or clinicians or whatever, properly.
Yeah, I think it's, I mean, obviously the whole point of this session in many ways is to look for some of those similarities, and I think you're totally right that for some places that kind of induction piece has changed, hopefully for the better, but I definitely have distinct memories from not so long ago during my training, arriving on a new rotation, starting on a night shift and having no idea what I was doing. And I think there are very few places where you carry the burden of responsibility that healthcare professionals do, where you'd be put in, you know, quite frankly, sometimes a fairly unsafe and unsupported situation like that. So definitely I think that's something that's vital, is being able to protect ourselves. And I think it's for people who are organising rotas and training schemes, etc., to really think about how we can do the best to make people feel welcome and supported in a meaningful way, and not just in a kind of tick box way sometimes as well.
Yes, absolutely.
In terms of sometimes, obviously, I think particularly for Pam and John, you've obviously had the opportunity to have such varied and diverse careers. Would you be able to talk a bit more about kind of helping to create boundaries sometimes, and making sure, you've spoken about the kind of huge role that obviously a career plays in someone's life, but how do you kind of protect some of your time for other things as well, and how do you make sure you don't take on too much? Do you have any tips that would be useful there?
Do you want to talk about that first, Pam?
I think I could get a bit repetitive, because I would have done it better if I'd had more help at the beginning to talk things through with people, instead of just rising to every challenge and thinking, yes, I can do this, which of course is rubbish, I couldn't. So I don't think I'm possibly the best person to talk about establishing boundaries, except, as I say, just listen to others, recognise you need to be a whole person, recognise that there's more to all of us than being a doctor, and there is more to life than being a doctor, and being realistic about the extent to which you are responsible for the ills of the patient and the ills of the world. You don't make them sick.
Definitely.
Yeah, it's a very good question, this. And I guess if you think about it, the history of GPs as archetypally described by people like Sassel in The Fortunate Man and other literature, is that the job of a GP was all-consuming. And we used to be on 24, 365 day-a-year contracts. And that changed about 15, 20 years ago, something like that. Now we can organisationally set our boundaries more than when Pam and I started out. I think it's probably true to say out of hours, for example, has been taken away, or rather you can contract into it if you like. So I think, in a way, the system, for all its faults now, that obtains is actually easier to set professional boundaries and formally hand over at the end of the day and not take those worries home with you. Claire, in the first session this morning, mentioned the Friday evening going home, worrying about the child who had a temperature and may or may not have had something serious, and that uncertainty that you were sitting of. Wrapping a boundary around that, I think, is more difficult than wrapping a boundary around your professional to personal life. And maybe you do that as the years go by experientially.
Mm-hmm. Fantastic, thank you. Before we come to the audience, and again, people online do keep submitting questions in the Q&A as well, I just wanted to ask one further question, which is, a lot has changed with general practice. A lot is always changing with general practice and healthcare in general. And for the different perspectives that make up this panel, looking to the future, what are your kind of hopes for the future of general practice? What should we hold on to, or what should change? Chee, I'll come to you first.
I think for me, I think we're increasingly realising that a lot of care is going to be given in the community moving forward. And with that, not only do we need more GPs, but we also need patients to be able to take care of themselves in ways that they probably aren't doing as much now, because we've become very, very medicalised in our approach. And I think, things like teaching people to self-care. I know the NHS England have recently released a strategy for self-care. Empowering patients to do this is going to be absolutely key. Engaging with your local community, I think, is definitely a direction that we're going to be heading in, and starting to sort of demedicalise some of these sort of common things, the common self-limiting conditions. You don't need to go to your GP for everything, but actually empowering patients to take care of themselves, knowing when to stay at home and manage things, or when to go see the pharmacist to pick up a few over-the-counter things, and actually when's the appropriate time to come and see your GP. Because otherwise, the system's going to break if we don't start looking after it better, and it needs that combined approach with doctors doing it, but also encouraging patients to do it as well. So I think there's a lot of work to be done there in terms of patient education and self-caring.
Pam?
I'm actually very worried, and I think general practice will have a good future only if those of us who really understand what its value is can get our voices heard. That relationships do matter, sometimes, not always. We all know with good consultation skills you can get a good relationship quickly. Complete strangers will be revealing physical and all sorts of intimacies within a quarter of an hour. But there are times when you only get good health outcomes by building on a relationship. And a GP is a lot more than somebody with a GP qualification sitting in an urgent care centre seeing people they'll never see again. There's got to be a structure that includes the option for long-term relationships. And to make the profession attractive, the speciality attractive, it's got to develop so GPs can have good working lives that progress with different things at different stages, as John has said. And I think we could get this. I think general practice in 20 years could be as better again from how it is now as it was historically between the mid-60s and the mid-80s. But only if we are very loud in any sphere of influence, we or our contacts, use your voices and we'll have a future. Otherwise, it'll be polyclinics and private GPs.
John?
That issue of continuity of care is so fundamental, absolutely fundamental. And just to push the political angle a little more, Pam, my feeling, for what it's worth, is that our political masters don't value it. And that is something that we probably need to take up through our representative bodies that may or may not include this college. This very week, our Chair of Council, Martin Marshall, has reminded us that the new plan from NHS England did not mention workforce, and he's been banging on about that for a long time. But to go to the positive side of things, I'd agree with what Pam said, and for me the big potential change, other than what has already been said, is this move encapsulated by the terms general practice to primary care. So in the last year or two, what we've noticed is that our teams have dramatically increased. We now have physios, pharmacists, mental health workers, all sorts of people in what will need to be very developed multidisciplinary teams. And that is such a change from when I started out, when we just had 4 GPs and a couple of receptionists. Now that clearly would not work in today's world, and we must seize the opportunity for working with all our healthcare professional colleagues, with all the complications as well as advantages that that will entail.
Definitely. And so with that, and then I definitely will be coming to the floor, quick question based on what, John, you've just said. In the future, do you see this as being the Royal College of General Practitioners or the Royal College of Primary Care?
Now, one has to be very careful here because the immediate past president is sitting in the audience. Interestingly, the paediatricians had a real battle about this 5 years ago when some younger paediatricians tried to change the Royal College of Paediatrics and Child Health into a much larger body for all the people who looked after children. I think we should have the same discussion in this college. It's just my opinion, for what it's worth. And we should move to become a Royal College of Primary Care. That may be contentious to some people in the audience. I'd love to have a discussion about it.
Yeah, we'll definitely. I would be really keen to hear what others in the audience think as well. But Pam and Chee, what do you both think? Pam?
Primary care is a lot more than general practice, but general practice is uniquely general practice, and there'll be room for both, I suspect.
And Chee?
Gosh, it's very contentious, isn't it? I'm put on the spot here. This is not a question we had pre-prepared. But I think it's really important to be mindful of, actually, there is so much to general practice that is beyond just the GP, and acknowledging actually the wider team that makes primary care work and being able to deliver community care well. So I think, yeah, discussion would be great.
Thank you. So we're going to come to the audience, and I have got a question on the Q&A as well, but let's go to the roving mics first. Does anybody have a question or a reflection on what we've discussed? Yes?
I'd just like to reflect before I rush off and become a grandma for the evening, that everything that's been said on the stage, I think, really gives us some food for thought afterwards. So the question of generalism, I gave a talk just this week online to a Middle Eastern conference, actually, in Dubai, about genuine generalism. And if you remember the Commission on Generalism that we hosted here in 2012, challenged the whole of the NHS to think about the role of generalists and how important they are, including raising, respect for our disciplines. So keeping that is a really important part, of many health services around the world are trying to create that and retain that because it's effective and efficient and it can be patient-centred. So big applause for that. Big applause for Pam's sort of concern that if we don't articulate it and hold it, and that will fall to younger colleagues as well as to people in, my end and the leaders and so on, then it's easy for systems to lose some of those roles and to see, private sector emerge and so on. I think it's great, very nice to see, training complemented, but we're still having the discussion about making it longer and stronger. And I think, and then finally the question about identity is what I wanted to comment on around the College of Primary Care. Yes, we do want to champion primary care and the effective multidisciplinary team, but I think at the same time, the identity of GPs is still, even after all this time, is still a little bit fragile. And I think if we lose that name, it's been the same debate in WHO, strong primary care, you say, oh, does that include family medicine? General practice, what's that? So, I think we've got to do both. Thank you very much, and well done, everybody, for hosting this.
Thanks, Amanda. Any other questions from the floor? Yes.
Hi, well, thank you for sharing your experiences so far. I'm a medical student who will definitely be leaving here much more determined to be a GP than when I first walked in. But something that I feel like has been really spotlighted, especially, dare I say it, on Twitter, the burnout that GPs are currently facing, especially coming out of the pandemic, and how many in the career who've been GPs for decades are actually now leaving the profession due to that, demand. So I just want to ask your personal experiences of burnout and how you've remained optimistic and overcome those barriers.
Excellent question. John, what do you think?
I'm very conscious of that among, among colleagues. I've got to say, I've never felt the symptoms and signs of burnout. And I don't, offer myself as a role model by saying that. I just think the way I've tried to say no to doing too much and adjusted, if you like, the workload within each week has helped me avoid that. Our practice is very busy. I'm now what's called a retainer GP, which means I do a day, sometimes 2 days a week, and the rest of the week I'm doing other things. And I think that mix, what is sometimes called a portfolio, but Claire definitively said was full-time this morning, and I'm glad she did, actually helps you do that, keeping yourself doing all sorts of different things, which is in the nature of generalism, to which Amanda has just pointed us.
Chee, Pam, what do you think?
I think it goes back to something that Pam mentioned earlier about, we're people before we're doctors, and if we can't look after ourselves as human beings, we're just not going to be able to manage. And I think I experienced burnout for the first time last year, having, sprung into being a GP, in the middle of the pandemic. And yeah, I was really surprised because I'd never experienced it before. And through training, I was doing way more, I felt, than I'd ever done as a GP. But I guess the pressures are different, and just being mindful of that. And I did have to look at my schedule and sort of think, what is important to me, and not just as a career, but as a whole person. What do I need to prioritize here, and what do I need to cut back on? And you know what, since I've made those changes, life has been infinitely better. So there's definitely ways out, but sometimes you just do need to sort of reflect on actually, where am I at and what's important, and actually just make sure you're doing those things that actually make you feel human. Because if you can't be human and you can't be fulfilled in just life in general, you can't be a good GP. So you have to prioritize that first and foremost.
Pam?
I think getting variety at different stages of life, and not just dredging the same part of you all the time. And certainly it worked for me to change to do my master's and to reduce my clinical commitment. But I would hope that in future GPs will have good job plans, which will be revised throughout somebody's career. But I think what you say about the problems of burnout now, it is desperate that the powers with resources give resources to provide a bridge from where we are now to where we can get to. And I'm sorry that's going to take money, but so did track and test and trace, whatever it was. But we need a bridge to get there, and practices know how they can survive. They could come up with a shopping list. We've got to have a bridge.
Yeah, I 100% agree. I think that while there's a huge amount of opportunity by being a GP, it also is just a reality to me, and I know to many of my colleagues, and I'm sure many of us here, that I could not do 10 sessions of seeing patients. I could probably, realistically, over the last couple of years since qualifying, I know that I can only really ever manage 5 clinical sessions a week before I really start to feel it, and even that can be a push at sometimes. So if that's the case, and that's how increasingly people are feeling because of the additional complexity and pressures associated by being a GP, it also is pressuring to have to then think, how am I going to use the rest of my week, and what am I going to do to make up the money that I need to support my family and to live? And yes, GP is a relatively well-paid career, but it does come with a lot of pressure to then think, what are the other things that I'm going to bolt on here? How do I find those opportunities, and how can I build a wider career? So definitely, to me, something that we need to be thinking much more about is, as you just said, Pam, thinking about job plans and what those look like, and that doesn't just involve clinical work. And it comes back again to something Claire said this morning about people having a base in a practice or in a group of practices, but within that then being able to offer more opportunities and more things, and recognising that no human being can just deal with intensity in the clinical consultation all day, every day. So to me, that's something I'd really like to see change. But coming back to the original question, something that I think definitely will continue to change, coming back to John's point about the widening primary care workforce, I think there's a huge opportunity to becoming a GP. I still think it's probably one of the best times to become a GP. And as Pam says, we need people to be becoming a GP to protect what's so precious and vital about delivering primary care to the populations. So I've got a question on the Q&A that I'd like to come to, which is about joy and what brings you the greatest joy from being a GP.
Actually, the reason I'm hesitating is not that I can't think of any joys, but I'm trying to establish a lexical order to the joys plural. For me, anyway, I think it's probably when a patient comes and gives you the kind of story that Pam mentioned earlier with her drug misusing patient, when you've expended quite a lot of time, of thought, of effort, you've got to know the biography, which is, we value the biographical over the biotechnical in GP, don't we? And a positive outcome has occurred. So I agree entirely with that story, and it could be, you know, any one of a number of analogous situations.
Chee?
It just took me back to this patient I remember I saw when I was a trainee, and sort of a man in his 60s came in and was like, oh, it's just a medication review, doctor. I just need more steroid cream prescribed. Yeah, they give it to me every month or so just need that. And I was like, what do you need this steroid cream for? And he lifts up his trouser leg and he's like literally scratched himself raw. It's like, oh, honestly, the worst legs I've ever seen. He's like, yeah, it's really, really itchy. The steroid cream stops it, so I've just been using that for the last 20 years. And I was like, I rarely do this, but I was like, can I refer you to dermatology, please? He was like, yeah, okay, sure. And I did the referral, and I did give him the cream and, you know, gave him some guidance on it because he wasn't using it appropriately, which is why everyone's laughing. And I saw him, maybe it's like 6 months or so later, and he came back in for another medication review, and I was like, okay, how are you doing? And he's like, yeah, I'm good. I'm like, how are your legs? And he lifted up his legs, completely gone. And what had happened was he had this sort of like fungal infection on top of the eczema, and it was just a bit of a nightmare, but the dermatologist gave him some different creams to sort it right out. 20 years this man had been itching his legs and just had steroid cream given every month for 20 years, just cleared up. And his life was changed. He could barely work, it was so itchy. And it had just gone like that. And I was like, wow, I got to play that part in this man's life where like his life is better for it. And you don't get to do that, I don't feel, like in any other specialty. Like you can really see lives be changed. Because we can see the whole picture. We're not just, you know, prescribing, doing repeat prescriptions. Like, you can really make a difference if you just stop and look at the patient before you, and that's incredible.
Definitely. And Pam, I don't know if you have any other...
No. Seeing, I think it said, corny, but actually helping people get better. It's quite joyful.
Definitely. Don't think you can say it better than that. We've got just a few minutes left, so perhaps if we have one final question. Yes, please.
Mine's not a question. It's my contribution to the joy of general practice. And I think one of the joys that I would celebrate is setting up baby clinics, seeing the babies, and then eventually, over time, they grow up and bring their own babies to baby clinic. And that is just a joy.
Amazing. Do we have any, as a positive rate today, do we have any other reflections of joy from other GPs in the audience? Yes?
I'm not a GP, I'm a third-year medical student at King's College London. But I think I've seen the joys of GP reflected in the way that they teach, the enthusiasm, the kind of mentoring, kind of role modelling that I see in GPs has made me feel joyful, and I think that's just that's a kind of transfer of that joy, I can say, that I've seen in GPs. I think they're excellent role models, and that joy has been shared with the students. So that's what I would say as a medical student.
Oh, thank you.
Yeah.
I know there was a hand up there as well.
Legitimised nosiness. Insight into the lives of people that in our rather privileged lives we would not otherwise get to know. And I think that hearing the points of view of people I wouldn't otherwise have got across has made me a better person. That sounds a bit corny, doesn't it? But it's been not only joyful but useful.
100%. I think one of the things that I love most about general practice, which gets debated a lot, is going on a home visit and the insight that it gives you into a patient's life, the opportunity it gets you to feel part of a different element of the community that you might be working in. And I know that a lot of practices do different things with home visits now, but I would love the time to be able to do home visits with those who need them in a more productive way and make sure that's something that's kind of still enshrined in what a GP can offer to those who can't get into the practice. So we are at the end of the day. Thank you so much for everybody for your contributions. Thank you so much to our panellists, to John, to Pam and to Chee. Can we have a massive round of applause for them? We now have the drinks reception, I believe. Closing words. Oh, sorry, I'm so sorry. We now have the closing words. So I'm going to be handing over to Mona.
Hello everyone in the room and those of you who are attending virtually. And I'm Mona Colina. I was a GP too in Lewisham for 30 years. I'm retired clinically now, but I continue to teach. I was a trainer, so I teach international medical graduates of refugee status. And I'm also a mentor for the RCGP mentoring scheme. And I'm, chair of the later career and retired members group. And I just wanted to start by saying that when I was a child of 8, I used to visit a great uncle who was a retired GP, and he looked a bit like Einstein, you know, he seemed ancient to me. He's probably only a bit older than me, actually. But he used to come out of his study and tell me, this little girl, a GP never stops learning. And he always was in his studies learning all the time. And actually, this links in with the motto for the later career and retired GP group, which is lifelong learning, lifelong connections. And I think it could be a motto for the college, actually, because I think we all share, whether we're medical students right through, through all our life stages, a love of learning. So why does our group exist within the college, actually? It was really set up to keep GPs sort of in contact with their peers, but also to help them in the transition to retire. We talked a lot today about the importance of self-care and the importance of identity. But let's face it, if you started off wanting to become a doctor ever since you were a child of 8 or a teenager, and you've worked towards that through medical school, A-levels, medical school, foundation training, speciality training, then you work for 30 years or 40 years as a GP. Your whole identity, however much you like to say you're a person first and doctor second, the reality is your identity when you suddenly reach 60, and it seems only yesterday that I was 20, so that you've got to sort of realize that it's a big deal actually approaching retirement. So we were set up really to make this journey easier, for it not to be a cliff edge, for it to be a cliff path, and to see retirement from clinical practice. Let's focus on the retired doctors now for a minute. So we help those of you approaching retirement, those of us approaching in the transition, but also to keep the retired doctors connected with their peers. I mean, let's face it, as soon as you qualify as a GP, or as a doctor even, you'll get these financial advisors swarming around you, telling you where to invest your money, okay, and preparing for retirement. But I don't know about the rest of my cohort, but I didn't get any psychological preparation for retirement or for the transition. So that's what we're about. And the RCGP Later Recurrent Retired Members Group has got leads across the country. So can you wave your hands, those leads who are here? Thank you very much, because you've given us all, your fantastic support. So we exist. If there isn't a lead within your area, there should be a lead in a nearby. And thanks to COVID, now we meet remotely as well. And COVID actually has been a tremendous opportunity, because with pre-COVID, we'd been saying, retired doctors should be part of the community, but retired GPs returned in their thousands actually, to help clinically, through help non-clinically, through mentoring and various supports. And, we are one profession actually, and, we're always stronger together. So we're going off for coffee shortly, or drinks, whatever. So please do, Evie's speaking to you now, but do grab us in coffee and talk to us with any questions you may have. Thanks.
Thank you so much, Mona. Well, you may or may not know that I am not actually Dr. Lisa Jane Edwards. I'm not a doctor, so I'm not going to pretend to be. Lisa Jane is unfortunately unable to be here today, but she is one of our 3 pre-specialty training leads. So these are quite a new group, sort of set up to work with us, with medical students, foundation doctors, GP societies, who are key kind of networks in terms of building those peer relationships in medical school. I can see a past president of a GP SOC right there. And so those 3 have really helped kind of develop this area of work. So if you are a prospective GP, medical student, FY, career changer, whoever you are, we want to hear from you as well. And like Mona was saying, in terms of later career and retired leads, again, get out there, get in touch with your faculty, become your next student or FY or AIT or whatever you are, become a rep, because that's the way you get your voice heard, and that's the way we can kind of continue building some of this fantastic work. So we have a last bit of little housekeeping, which, if all goes well, will come up on the screen behind me. Yes, there we go. So feedback. We love a bit of feedback. Please do fill it in. If you're in person, it's on your badges, so you can take out the paper and scan the QR code. If you're watching online, the QR code is prepped, ready for you. Let us know what you think. Fill that in. And then if you are here in person, we have the 2 late sessions running at 4:30. So Qigong, which will be in room G2. And that's kind of something gentle at the end of the day to get you thinking about your breathing, moving in a different way. And then early career well-being in G1 with Matilda from Melanin Medics, who's right there. So something nice to kind of end the day on. So I encourage you all to go along to that. A huge thank you to all of our speakers and all of our delegates today. Those of you watching online, we've really enjoyed having you. Even though, we haven't necessarily been with you, and obviously those of you in person, it's been fantastic, I think, to bring these 2 communities together. It's super exciting. It's something we've never done before. We've never brought you all together. So if you like it, tell us, fill in the feedback. And if you are obviously still here, there are drinks just outside before you go to your late sessions at 4:30. Hope you have enjoyed your days. Obviously, continue the conversation online, use the hashtag, tag us, tweet us, all of that. And we look forward to seeing you next time. Enjoy.